Okay, so welcome. This is your postpartum nursing assessment for postpartum mother. So we are going to start off by following the IMP3 checklist as outlined on your Moodle shell or that has been distributed to you via your instructor. So the postpartum assessment is very involved. We use the acronym BUBBLE-HED, B-U-B-B-L-E-H-E-D, and each letter of that acronym is a focused assessment towards this mother. So one of the things we have to keep in mind when assessing the postpartum mom is the communication. You also want to be able to do a postpartum assessment where the mom is actually coherent. She's not too tired to listen to patient teaching that you're doing along the way. And the reason why we would complete this assessment is we need to have baseline data of the mother directly after giving childbirth and in those 2-3 days that lady may still be in hospital. Of course, as a practical nurse, you would be visiting some of these postpartum clients in their own homes. So the language that you use and also your assessment skills towards assessing the environment and making sure that the space is safe for you to work in and also safe for your client. Okay, so at the beginning of doing any type of assessment, I must reiterate that you must complete a quick priority assessment, which you've learned in other classes of IMP. So whenever you come in, you would check general appearance of your client. So right now, this lady is alert, although her eyes are closed. She's alert. She looks tired. That's her general appearance, but she is responding to my questions when I ask her what's going on. And maybe, Zafu, you can play the role as the mother. I'm just gonna ask questions. Just do your best to respond. Does that sound good? Yeah. Okay, so I walk into my client's room. I've sanitized my hands. I've looked at the patient's chart. And in British Columbia, we use the Perinatal Services of British Columbia sheet for the postpartum clinical pathway, which is also indicated in your Moodle resources, okay? So PSBC, we use their clinical pathway for all postpartum moms. Okay, so I wash my hands, I look at the chart, and I know that Zafu has given birth to a baby boy yesterday, and I'm the practical nurse doing the postpartum assessment. This is the beginning of my shift. So again, this is foundation assessment. I've never met Zafu before, and I'm meeting her for the first time. So I'm going to incorporate some communication, make sure to gather consent. That's very important prior to touching, and just being aware of my surroundings. Does that sound good? All right, so I come in and introduce myself. Hello, Zafu, I'm Amy. I'm your practical nurse today. How are you doing? I know you just had a baby boy yesterday.
I'm good. I'm just a little bit tired.
Oh, you look really tired, and so I'm gonna try and make this as comfortable as possible for you, Zafu. So just bear with me. It's probably gonna take about 10 minutes. 15 minutes probably maximum to get through all of my assessments. So I have to kind of wiggle my way through around here. And I know you've just breastfed your baby, is that right?
Yes.
Okay, and then so how is that going for you, Zafu?
That's going well.
Okay, great. And so you have a good latch and the baby seems to be eating, and that's good, great. And how many wet diapers has your baby boy had today?
5.
Okay, cool. He's eating a lot. Okay, right on. And what's your baby boy's name?
Adam.
Adam, great. Okay. Are you having any discomfort right now, Zafu?
I do have discomfort on my abdomen.
Oh my goodness. Okay, can you tell me a little bit about that? Have you ever used the pain scale before?
I don't really remember that.
Okay, so, okay. The scale is 1 to 10, 1 being no pain at all, 10 being the most excruciating pain you've ever felt. Zafu, can you give your pain a number?
Yeah, 6.
6, okay, and is that tolerable for you, Zafu?
Yeah.
Okay, all right, and have you taken anything for the pain in the past?
Yes, I've taken Tylenol.
Right on. Okay, so yeah, we do give postpartum moms like over-the-counter Tylenol and Advil at the bedside, so you've given yourself that. That's awesome. Okay, and can you tell me if the pain radiates or spreads anywhere?
It's just in my lower abdomen.
Okay, and I understand you did a natural birth, Zafu, so that's really great. And I'm going to be having a look at not only your stomach, your tummy, and your peri pad. So we'll get all that all sorted out for you, okay? All right, and I just wanted to ask one last question about your pain. Is the pain stabbing, or is it dull, or is it?
It's like dull pain.
It's a dull pain. Okay, I'll keep my eye out for that, and then I'll make sure that the OBGYN knows the next time she comes to see you if it doesn't go away, all right?
Thank you.
The next thing is, Zafu, I have to ask you, have you emptied out your bladder? Have you been to the bathroom?
I think I've been once today.
Okay, and you had a pee?
Yes.
Okay, great. Okay, so that's good. I always need an empty bladder. Oh yeah, we've got a catheter. Okay. So we have a catheter in situ, so we don't need to worry about that. So the next part of the checklist would be to wash hands, so it would sanitize my hands. And then I will always gather my supplies. When I come into the postpartum mother's room, I could bring a perineal pad, which we have some empty ones on that bin there, Danica, if you wanted to kind of put one here on this bed for me. Gloves, which we have here in my pocket, and a flashlight if indicated. So I always make sure that I have a clean work environment, so I'm always working at my height. Well, maybe a clean one, not a dirty one. I'm always making sure that the patient is at my working height, so the bed is at my working height. And then also I provide privacy. Now, most hospitals now, when a woman labors and delivers, they usually labor in the same room and stay in the same room in the postpartum period. So this might very well be a private room where the lady has given birth in this room, they've cleaned the room up, and now she's still in the room with her baby. Okay, so organizing the work area. The patient's position should be on her back, so lying prone. Oh, yeah. Oh, okay. And also now is the first start of the acronym. I've checked pain, I've communicated and liaised with her and developed some sort of rapport, and now I want to gain consent because I have to touch her, right? So Zafu, is it okay if I have a look around? I'm going to be looking at your breast area because I know that you've been breastfeeding, and then I'm going to work my way down, all the way down to the catheter. Are you okay with that, Zafu?
Yes, that's fine.
Okay, great. So now, according to my checklist, I can expose the client, and remember, only expose the client where you are doing the assessment. So oftentimes, if you are doing the postpartum assessment on the hospital unit, they will be still wearing their hospital gowns, or they might be wearing their own pajamas. So utilize your own discretion when exposing the site. So my hands are clean. I'm going to do this bare hands using clean technique. So expose the breast area, and so what you're looking for in this area is for any firmness or any softness, okay? So really have a look around, look at the nipples to see if they are cracked, if there is any bleeding, and are you having a palpate around for firmness or softness. We're also checking for tenderness to the breast area site. Of course, if you've been breastfeeding, over a significant amount of time, the milk is going to come into the breast area and the breast will feel engorged, which is really, really full. You might see veins to the region as well, and that just means as a reminder to the mother to feed the newborn quite frequently. So we're talking about every 2 hours. If you're in the hospital, we do kind of wake up the mom if the mom is sleeping, and we say, okay, it's time to breastfeed your child. So if that is the case, you need to go that route, okay? Remember, the more that a child breastfeeds, the more milk is going to be produced because it is supply and demand, okay? Another thing that we're going to be looking at when we assess the breast area is redness and warmth. So do you feel that to touch, okay? If you feel a little bit of firmness, it might be what's called a plugged duct. If you feel warmth and firmness, that may be a plugged duct. That might be happening after in that postpartum period. And what's happening is the child is not latched on properly, maybe, and there's not enough milk that is coming out. So the milk accumulates in the duct and it becomes plugged. It is so sore and painful for the mother. It honestly feels like you're being kind of stabbed with window shards, like it's that painful and tender. So make sure that if you are assessing the breast, that you are assessing both and comparing both. Does that make sense? Okay. The next thing that you're going to look for is the presence of colostrum. Now, the colostrum is only produced in the beginning period, directly after the woman has given birth. So it is the first milk that appears. That milk contains antibiotics. It contains all the nutrients that a newborn child would require in the first moments of life. So that's okay, right? So you're going to tell the mom about the colostrum, and then the more they are breastfeeding, remember, supply and demand, then the milk from behind the breast the real milk is going to come through. Make sense? All right, good. So we've done the breast. We look for soreness or crackness or any open areas in the breast or bleeding as well, okay? Now, thank you, Zafu. I've looked at, it looks like the breastfeeding is going okay, and then maybe we can talk at this point about how often you're feeding Adam, and I can ask questions towards the breastfeeding and do more breastfeeding patient teaching or the care of the breast also. So one of the ways that we can manage engorgement in the postpartum mother, we like to teach about having showers and not having the water hit directly the breast region, maybe showering with our back towards the shower. Also, we like to mention that you can apply cold maybe lettuce leaves or cabbage leaves on the nipple area or on the breast for that cooling and let's say decreasing the inflammation to the breast side. So cool cabbage leaves. Okay, so the next letter in our acronym of BUBBLE-HED is going to be the uterus. So now, Zafu, I'm going to open up the blanket a little bit more. I'm just going to assess your uterus, okay? And I know that you just had Adam yesterday, and I'm going to have to palpate around, and it is going to feel uncomfortable, okay? So when I do this, again, Zafu has delivered naturally spontaneous vaginal delivery, SVD. So what I'm going to do is find the pubic bone with my non-dominant hand, and I would secure the base of the uterus. I would then traverse, upwards towards her head, and I'm going to palpate for the fundus. And the fundus, remember, is the top of the uterus, okay? So directly after giving birth, this uterus wants to shrink, okay? And then how many days will the uterus sort of be non-palpable? Do you remember from your reading? 7 to 10 days, okay? So when you palpate, we are looking for the top of that uterus. And when we do that, we're also assessing whether or not the top of the uterus is what we call boggy. Boggy means soft. If you have a soft or boggy uterus, it's more increased risk for a hemorrhage. We want the uterus to keep shrinking, right? It wants to go back to its pre-pregnancy state. So we have to continuously massage it. We want the top, we want the fundus to be firm to touch. And we also want the location of the fundus to be midline. So wherever the belly button is, we would expect that the fundus is also midline. If the uterus deviates to the left, oh no, in this case the right or the left, it means maybe there's a full bladder going on. Maybe they need to have a bowel movement, okay? So for uterus, again, support the base, traverse upwards. We are looking for the top of the uterus, which is the fundus. If we find it and it is soft or boggy, we are massaging it back into place, okay? We tell the mother that she should empty her bladder ever so often, and then also that if she notices her belly or the fundus being soft or boggy, she needs to massage it as well, okay, when we're not around. When you are massaging it, chances are that you may be expelling some blood clots or increased blood to the peri-pad, okay? So just imagine I'm massaging someone, actually causing a contraction, okay? Imagine doing that. That is so uncomfortable. So whenever I do this for moms, they might be grimacing, or they might be like, oh, you better stop because that doesn't feel good, okay? But that's what we want to do. We want to make sure that there aren't any blood clots, there isn't any hemorrhaging happening there. We want it to be firm. But at that same token, again, as you're massaging it, you may be expelling blood clots or increasing the blood flow to the vaginal area. Make sense? Okay, so in our checklist now, we've checked the uterus, the location, the height, the firmness. We've done some patient teaching there. And now what we want to do is assess the bladder, right? So one of the things that you can do, because Zafu has a catheter in situ, right? We look at the color, the amount. Is there any sedimentation? Is there any blood clots, right? Very important. You also want to look at the amount and drain that catheter bag ever so often too, just to make sure there isn't any foul odor, right? Okay, so in this case, she has a catheter in situ. If it is a mom that is ambulatory and is voiding in the bathroom, you can ask her to keep the void that she has in the toilet to see if it has any blood clots. Does that make sense? Okay, blood clots, it's okay to have them. It's normal to have the blood clots, but we are looking for abnormally sized blood clots. And what would those be considered? Do you remember? More than 2 loony-sized blood clots, in a peri pad, something's up, okay? Again, we're gonna go to the peri area now. We've done breast, uterus, and now we're gonna go to bowel. We're looking for the last time they had a bowel movement, okay? We also gonna do a look, listen, and feel, which you've learned in other IMP classes, so that's a focused abdominal assessment, look, listen, and feel. And then we're gonna ask for the last time they went to the bathroom, okay? Now we wanna look more into the peri area. So this is the next letter of the acronym. We've done B, U, bladder, and bowel, and now I wanna look at lochia. So now I can't be manipulating that without donning clean gloves. So at this point, I would don clean gloves. And there are different stages for the output, the drainage you're going to receive in a peri pad. So let's think about what those are. The first stage, the first 3 days is called lochia rubra. The second drainage is going to be lochia serosa. And how many days does lochia serosa last for?
4 to 10 days.
4 to 10 days, okay. And then towards the end of the postpartum period, maybe day 10th, up to 3 to 4 weeks, we will get lochia alba, okay? So I am now in the peri area region. I've asked for consent and I'm looking at the peri pad and I see that there is a moderate to large amount. So I'll just show you right here. It's not saturated. This is a moderate to large amount, okay? Do you see any blood clots on it? No. Okay, and keeping in mind, I did massage the fundus and I don't see any blood clots. Some nurses will also pull down the peri pad in these mesh panties as well as massage the uterus and they are looking for blood clots. I don't see any blood clots here. I've done patient teaching towards the different stages of the vaginal discharge, rubra, serosa, and alba. Okay, so these peri pads are great and these mesh underwear are great. The next letter in our acronym will be E, right? So when we look at the E, that reminds us we're in the peri region, and so we're looking for an episiotomy, okay? So for here, if you know that the lady has done a spontaneous vaginal delivery with an episiotomy that has been done, that is a surgical cut. And so what is the the acronym we use to assess a surgical incision?
Rita.
Rita. So you're looking for, say it loud and proud. R is for? Redness. Edema. Yep. Drainage and approximation. So I would actually turn my patient over to their side and have a look. I can have them open their legs while they are in side lighting position, grab a flashlight and look at that episiotomy cut. You can have an episiotomy that is a straight cut, or you can have it medial it might be looking like the shape of a J. Those sutures, as a result of an episiotomy, are dissolvable, okay? And if you smell any foul odor there, or you see that the skin is not well approximated, what would you do? Enforce proper peri care with the use of maybe a peri bottle. I think behind you, Danica, there is a bottle there, a spray bottle in the tub there. What you want to do is encourage proper care of that area, because you do not want an infection. So if they're in the bathroom, encourage the use of what's called a peri bottle, which is this. You would put warm water in it, not steaming hot water, but warm water in it. And anytime they go up to the bathroom, either to void or to have a bowel movement, then they are spraying their peri area, especially the episiotomy site, and they are dabbing it dry, okay? It takes quite a while for an episiotomy to fully heal, and a lot of infections, bacterial infections, can arise, as you can imagine, in the location that it is in, because again, it is a cut from the vaginal area all the way to the rectum, the anus. Okay, so that is like in a weird position. It may be prone to bacteria or contamination. Okay, so we've done episiotomy. We've looked at the location, whether it is a straight cut or medial. We've done the acronym for RITA. So now we're going to move on. I guess when we're looking in that region 2, we can look for hemorrhoids because they're already in a sideline position. So for comfort's sake, after you look at the episiotomy, let's go and look at hemorrhoids. So for hemorrhoids, you're looking at the number of hemorrhoids, maybe the location and the size. If it is uncomfortable for a woman, there are ways to soothe the area. One of those things can be sitting in a sitz bath at home or in the hospital. We can also give what's called Anusol, A-N-U-S-O-L, to the area. There is also another form of relief called Tux. So there are a number of things we use in hospital and in the community that can help with hemorrhoids, okay? So continuing on, we've done breast, uterus, bladder, bowel, lochia, episiotomy, hemorrhoids. There is another E, and what would that be? Emotional. Okay, so in terms of emotional status, I would be asking Zafu more questions maybe related to coping, okay? So Zafu, how do you feel about this baby boy? Like, who's involved with raising Adam, or how are you feeling right now?
I'm feeling good, and my husband is helping me a lot.
Oh, that's great. Okay, so he's putting his time in and helping with diaper changes and stuff like that?
Yes.
Okay, and then how are you managing when baby Adam is crying or seems fussy?
I usually pick him up and I put him to sleep.
Okay, great. So there's a significant, like, she's verbalized that she is making motions towards bonding and attachment, which is so important in the postpartum period. What do we know about emotions in the postpartum period? What kind of things may happen to mom? Mood swings, postpartum blues, right? And so because as a result of being overwhelmingly tired and being awake all times of the evening, responding to a newborn child, the hormones are also out of whack, and the sleep-wake cycle is out of whack too. So they may be experiencing postpartum blues. Maybe they don't think what they're doing is good enough, and they're not quite sure what's going on with them, okay? Emotional status could also look at sleep patterns. So I can teach Zafu, like, what I always tell moms is, like, if baby's asleep, Zafu, you sleep too, okay? Promise. I know you want to look at Adam, but when baby is sleeping, you sleep too. Because you've chosen to breastfeed, you should breastfeed Adam every 2 to 3 hours. That's just the way of the beast right now, and it'll get better over time. But make sure that you get some rest and really utilize your husband. What's your husband's name?
Eric.
Eric, utilize Eric as much as you can to help you with food, or maybe if you've got other family members to cook you food. You really need this time with you and Adam. So I encourage to sleep when he sleeps as well. Okay, and so we're coming to the last kind of phase of the assessment. We've talked about emotional, and there are different stages also that you can teach the mom according to the checklist. There's the taking in phase, taking hold, and then letting go. So I won't go into that in too much detail because it's already in your checklist, but you can patient teach towards that, letting the mom know. We also worry about emotional status by way of postpartum depression, because that is a real and significant thing that impacts ladies after childbirth. It could be your first child, second child, third child, or you've had 5 children. It doesn't matter. Each pregnancy is unique. And so we should take the emotional status of a mom as being really like individual and unique for them. So really patient teach the difference between postpartum blues versus a postpartum depression. Okay. So now we're going towards the end of our assessment. We've done the BUBBLE-HED, and now there's a D. So the D stands for DVT, which is a deep vein thrombosis. So you may have learned this in other levels. Zafu, I'm going to have a look to see if how your legs are doing. And the reason why I'm doing this is because I want to really check to see if you're at risk for throwing a clot. So clots like to live in our lower extremities. So are you okay if I lift your leg up?
Yeah, that's fine.
Okay, great. And so what I'm checking for is the calf region here. I'm looking for warmth, redness, and tenderness, okay? They like to check to see back in the day about Homan sign, which is a dorsiflexion of your toes to your nose. So upon dorsiflexion, is there pain in the calf region? So if there is pain in that region, it's considered a positive Homan sign. And it might be an indicator, as well as the warmth and the redness and the tenderness, to get maybe some blood drawn or have an ultrasound done to see if there is a clot that exists in that area. You would do the same DVT assessment on the other leg by lifting it up, checking for redness, warmth, or tenderness, asking for dorsiflexion. Again, dorsiflexion, pain upon dorsiflexion would be considered a positive Homan sign. Okay, so I think that is the whole BUBBLE-HED assessment from head to toe, which includes patient teaching, and it includes communication, how you would communicate with your client. So that ends your focus assessment for the BUBBLE-HED maternity.
Yay.